Hello, all. This is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology. Today we have Dr. Anvay with us, and he is, DNB third year anesthesia resident in Pune, Jahangir Hospital. So he is actually from West Bengal, and now he ended up in Pune. Welcome to the channel, Anvay, and we want your full story and how we actually your journey started, how you ended up here, and we want to know more details about your college and other colleges of Pune. Welcome.
Yeah, yeah. Hi, sir. Introducing myself, I'm Dr. Anvay Bhattacharya. I did my UG from West Bengal, from a periphery medical college from West Bengal, and from the initially, when I gave my exam, I am 2021 batch, but we due to COVID and all, due to counseling delay, we got our admissions in February 2025. Our batch started basically. I joined here in second round only. So my taking DNB story is a little different. Like I was from the previously, I was too much motivated to take DNB. One of the important reason I would say that after my internship, I did 6 months of housemanship in a government GMC in an anesthesia department only. So, and anesthesia also was my second choice, I would rather say. My first choice was to take medicine. General medicine was my first choice. So, after the ranks came, like since I have experience in working in periphery GMC, I was working in the anesthesia department only. So, I had seen the kind of work. So, but after seeing that, I always had in my mind that I wanted such kind of institute which could provide me with variety of cases rather than same case in lot of numbers. I am not fond of that. So I am more into like I want variety. That's why I looked upon the all the DNB institutes and all. So from the counseling initially, I had a target that either I will, if I get MD in premier institutes, and rather I will, if I don't get those, then I will go for the DNB institutes, good DNB institutes like corporates. So and that's how I like my target was to go to Delhi. Gangaram was my first choice, basically taking DNB anesthesia in Gangaram, which I did not land up to, and I just took accidentally came to Pune. Anyway, Maharashtra was my second choice, obviously for institutes. So I landed up in Pune in Jahangir Hospital. So like after completing 3 years of my residency, I'm in my just end of my residency, like 2 to 3 months remaining. I will say that initially, like in anyone's minds, listening to DNB, people do have a speculation that you get less hands-on or something like that. But I never faced these kind of things in my institute. Like I said that I got my first intubation attempt in my fourth day of my residency, and like I failed anyway, but still we have very good free hands-on. Consultants do teach us directly, and like we get taught like properly, they will teach, and we have good academic sessions also. Every Monday and Friday is our academic day when we have some case discussion or some topic discussion, like we get system wise, and teaching is also there regularly. And in terms of caseload, like here we have 9 OTs, and apart from that, there is cardiac cath lab, endoscopy, suit, MRI, where we also get posted. So, an average number of cases per day is around 30. So, and number of residents here is basically three primary seats and three secondary seats. Now, secondary seats after my batch is not filled. So basically now all primary candidates are right now. But number of residents is less. That I would say rather in a way it is a bless to me also, because for that I got a lot of things to do, like everything, whatever possible apart from like fewer things. I would say rather 80 to 85% things which we can learn in an institute. My institute taught me, and I'm really like it's a blessing to me that I got landed to this hospital. Now, one thing I would mention here that initially when I took admission here, so there is a thing in our minds when we go to counseling that DNB from a 500 bedded, more than 500 bedded institute, less than 500 bedded, and all those things are there. So at that time, sir, I was also little bit in doubt that basically it's a 350 bedded hospital. We have 350 bedded hospital. So I was in a doubt that might be I won't be get taught properly, or I would have some like something less than any comparison to any 500 bed or something. So then I texted you also, sir. In Instagram, I contacted you and I texted you also, and you replied back also. So you motivated me a lot. That if you want to if you want to learn properly, then if and your institute guides you properly, then obviously in any place you can learn properly and you can get good training and all. So then I never gave a second thought, because from that day when I joined anesthesia only, I follow your channel and all. In Pune, overall picture, if I talk of anesthesia, I would say that there are prime 5 to 6 institutes which are very good for DNBs to take up DNB. First, I would mention is Dinath Mangeshkar Hospital. Dinanath Mangeshkar, I would mention first is because going to that again that thing that it's a more than 500 bedded hospital, and the good part is Dinanath it has good caseload, very good caseload, like more than comparison to Jahangir, I would say, and very good hands-on also. And Dinanath has very decent hands-on. Next, if I would rank something, then I would like to rank Jahangir, though it's a 350 bedded hospital, and there is another hospital, Ruby Hall Clinic in Pune, which is more than 500 bedded hospital. But if we compare about the number of hands-on and number of procedures as residents we get, okay, free to do freely, like in guidance of consultants, obviously, but the number of procedures we get and the earlier we learn, earlier we get trained. Anyway, we have Jahangir has a better hands comparison to Ruby Hall. Like we have a little bit better hands on, because one thing is Ruby Hall has number of lecturers also, there are more. We have only one single lecturer. Now maximum cases, like we and our one consultant, so we manage one OT. So how many, like per day, like each OT is having 3 to 4 or 5 cases, okay. And also on calls, on calls we have usually in first year we have two first on calls, that is we have to do two emergency nights and one second on call. And now we are basically placed singly with one consultants in calls also. So in calls also, whatever emergency comes, we manage it with the consultants. So number of lecturers we have only one, whereas in comparison in Ruby Hall they have lecturers, they have fellows also. So I think somewhat the hands-on get distributed a little, and in that way we are blessed. And also talk like apart from academics, also if I say hostel facility of Jahangir is very good. What we get, Ruby Hall hostel is not that good. So I would rather keep Jahangir a little bit upper hand than Ruby Hall. Otherwise, case wise, both are good. Not nothing is more better or something. So Jahangir, then comes Ruby Hall. These three are prime institutes in. If you talk of DNB anesthesia, I am talking mainly. So these three are prime institutes. Apart from this, KEM Pune, KEM Pune is also like old DNB institute definitely, and that is also okayish, but a little bit caseloads and all. Previously, it was good. It has fallen down a little bit, to be very honest. And apart from that, there are Nobel Hospital, Pune Hospital, uh, but those are not at par. What I would rather say, to be very honest, like number of cases, because number of OTs also are less there, and number of cases comparatively is a little less. So no, basically no offense to anyone. Obviously, every institute is having advantage and disadvantage, whatever. So, if you get less hands-on, so you're getting more time to study. So that is also a positive thing, I would rather say. In Jahangir, I would definitely say that workload is it's a good amount of workload. Yeah, it is if someone loves work. See, basically, sir, I am such a person that I love working. I love working. Like I'm like so that's why that is one of the reason also why I love anesthesia, because when my first choice was medicine. Now after the rank came, I was not getting medicine, to be very frank. I was not getting general medicine. So and my second choice got was anesthesia, because when I worked in that 6 months in that housemanship, so I don't know why, but I had a good, like, I felt thrill and a very good feeling about the subject when I was doing that housemanship. So then my liking got into, because in internship we don't get exposed to anesthesia very honestly. I did not attend my anesthesia posting also in my internship. So at that time I was more like I will do general medicine only. That was my only choice. But after doing that housemanship, I was very much like motivated. I saw a lot of, like, I was working with some senior anesthesiologist who was a SR in that institute. He was a senior resident. So that senior, seeing him, I got like very much motivated, because I am such a guy. I like a little bit of adrenaline rush, but not like the emergency person, like full time adrenaline rush. And I love procedures. I love doing procedures, and I love technologies also, like newer machines, newer things, like all these USG guided techniques and new ventilators. Like I am very much fan of these new trigger machines and all, like the touch screen and all. I love it. I am little bit into like technology, you can say. So that's why I loved anesthesia a lot. And the one and also like the seniors whom I observed in that working at that time, it made me like a fan of anesthesia. So then when I decided that if I don't get medicine, this is going to my second choice.
Good.
And like this is a short story.
Yeah, super.
I can say.
Ultimate.
Yeah. Yes, sir.
Basically, you spoke about few colleges. So next part of the
Yes, sir.
video will have the, I'll show the list now of different colleges. And
Yes, sir.
about these three colleges, you know in detail. You spoke about anesthesia, but what about other departments? Like there are
So
surgical.
other departments, sir, basically my roommate is doing surgery. He's a surgery resident in my institute. So I would rather say, obviously, in surgical branch, the normal what the thing, the notion is that basically doing MS is better, because somewhat you don't get that much of free hands being in a surgery department, because all are paid patients and obviously consultants will give. But at the end of third year, I would say that like if I'm talking of general surgery, like the basic procedures, whatever, like the bread and butter, so that those things
Hydrocele.
you get exposed good, and you will get decent amount of hands on. But any day, if like I am a full non-surgical person, so sir, I never thought of surgery. And like, but if you I would say that you should prefer MS than doing DNB. You can do DNB obviously in a government hospital, that is no issues. But I would rather keep MS or DNB in a government rather than doing DNB in a corporate. And other
Medical
branches,
branches.
medicinal branches, definitely it is always, I would say, like if someone is doing MD from a periphery institute, it's always better to go for DNB in a premier institute. It is
Super.
always better, because I think that the best part which I like, if I talk of anesthesia or something, the best part which I like is that see, in any medical college, what happens that your senior teaches you any procedure or something. Okay, so like it's like the third year is teaching the second year, the second year is teaching the first year. So I think every person, when we learn some procedure or something, every person has a like some flaws everyone have in doing anything. But when you learn it directly from a consultant who is an experienced person in that field, I think we get better training. It's like it's my feeling, totally my thought. I think we get somewhat better training comparative to learning from a senior. And and instrument wise, infrastructure wise, case wise, so any day I will keep a premier DNB institute above average MD
But
institute,
these three
definitely, for
institutes,
anesthesia.
so any
Yeah,
specialty other than surgical in these three institutes are good, correct, no?
definitely,
When
yes
you
sir.
talk about
Medicine, medicinal
medicine,
branches, radiology,
pulmonology, yeah,
yeah, radiology, medicine,
radiology,
and pediatrics also.
dermatology.
Like these branches are good. Yeah, these three institutes are good. And like the rest which I am talking of, they are okay, okayish, not
I can
that
understand.
okayish. It's
So
okay. Like if
overall, DNB surgery is not surgical branches are not preferred. I can
surgical
understand.
branches is a little bit still
Little,
Dinanath has a because the number of cases is a little more in Dinanath, so might be like a better hands-on, like more exposure or more something like that. Basically, Dinanath have robotics, so we don't have. So Dinanath is having robotics, which they so we don't have robotics in our institute. And so basically, Dinanath might have a little bit in surgical branches, a little more cases. That is the advantage, but any day MS sir is better.
got it.
MS is
So
definitely better. Yeah.
then I will share the screen just to show you the other hospitals. You can see my screen, no?
Yes, sir. Yeah. Aditya Billa, ACPM Medical College,
Yeah.
Dhule. So this is a new medical college in
Okay.
just like
Only cardiology is
started.
there. Anyway, cardiology, nephrology, we don't know, right? So we
Aditya
have
Anand Rishi ji is also not like these Anand Rishi ji and all. They are a little periphery part. It is in periphery of Pune. It is not
okay.
in proper Pune, Ahmednagar. Yeah.
So how
So
is
it
this
is
hospital?
also
Okay. Bharati Vidyapeeth,
Bharati Vidyapeeth is a private medical college. It is good, sir.
good.
It is good.
Okay.
It is good. Okay.
There's
It is
only
good.
the reproductive and fetal medicine.
Yeah, but these are DNB seats like Bharti.
And I think super specialty DNB. So we'll go and
Okay, sir. No, Bharti Vidyapeeth Medical College is the old medical college and in Pune, and it is good. It is a good medical college.
put more
Private one,
place.
but it's obviously good.
Got it.
Good medical college, sir. Yeah.
One more in Pune.
Dinanath I talked about, sir.
Yeah, Dinanath they spoke about. Yes, correct.
Yeah, Dinanath is good.
Dinanath. So many. All
Yeah. Yes, sir. They actually, it's a big hospital. It's a 800 bedded hospital and good caseloads, and like they have all
also,
kinds of.
it's a special, super specialty hospital, man. Basically,
Yeah, it has a super specialty. It has like various branches of super specialty. There is our anesthesia fellowships are also there in
uh,
Dinanath.
see, even
So
clinical, if something is having clinical hematology, that means it's a
yeah,
proper super specialty
yes, sir.
hospital.
It is a proper super specialty hospital. Yeah, they have. It's a good hospital, definitely. It's the best. Like in Pune, if someone is taking, I would